Now comes HIV, right? Now, class 2 of HIV associated diseases, उसका मतलब क्या होता है? So basically, doctor, you have group 1, group 2, group 3, group 4. That's how you divide. Acute opportunistic infections are called group 1. Asymptomatic infections are called group 2, opportunistic infections. Persistent generalized lymphadenopathy is group 3. And all the systemic complications are all called group 4. That is how the classification has been done in case of HIV. So once more, examiner's question. Secondary infections in HIV infected patient is called class 4. Class 4 is what you should remember. What is an early manifestation of a person who is infected with HIV? Unexplained fever and weight loss. That is the earliest clinical manifestation is what you need to remember. So typically once infection occurs, 1 week viral RNA, second week P24 antigens, third week enzyme immunoassay, fifth week Unigold Aura Quick, then also Western blot by fifth week. So this is typically the timeline of detection. The disease that is not an occupational hazard to the dental surgeon. Dental surgeon can have a needle stick injury with HIV, hepatitis B, herpes, any of them, not enteric fever. So what is the rule of 3? Rule of 3, please don't forget, in occupational needle stick exposure. If at all there is a needle stick injury, hepatitis B 30%, hepatitis C 3%, HIV 0.3%. You'll remember that? Hepatitis B 30%, hepatitis C 3% and HIV 0.3%. Needle stick injury. Twice I had HIV needle stick injury. Twice. And I had once hepatitis B needle stick injury. Then hepatitis C, but that was a worst day. It was a dialysis patient, while putting the central cath, ekdam blood splattered into the eyes. Patient's blood splattered in my eyes. So every time I only prayed God, if it is your wish, I am ready. But if it is not your wish, nothing will happen to me. So that should be first your courage, let me tell you. Whenever there is a needle stick injury, no point in running in panic. Definitely there will be panic. It's not that easy as what I am saying. But a good number of people, needle stick injury, at least I don't know any doctor getting through needle stick injury. Hundreds of my students also used to call whenever they had a needle stick injury. So hepatitis B is 30%, hepatitis C 3%, HIV 0.3%. That is the rule of 3 is what you need to remember.